Hi, my name is Maria Paula Mosquera and my topic is Peutz-Jeghers syndrome. In definition, we have that Peutz-Jeghers syndrome is an autosomal dominant disease with multiple hamartomatous polyps in the stomach, small intestine, and colon, along with characteristic pigmented skin lesions. Now we have the video.
Hello and welcome. We have today another session of digital slide review and sign out with Dr. Hassel. I'm Louis Hassel, speaking to you from the University of Oklahoma, home of the hopefully increasingly famous Stevenson Cancer Center, an NIH designated cancer center on our campus here at the University of Oklahoma Health Sciences Center. Our case today actually is a potpourri of cases. PPP, a potpourri of Peutz-Jeghers polyps. So let's jump right into what may come across your microscope as such, and we'll sort of reorient this so that we're following conventional morphology here. Obviously a resection specimen. We have muscularis here, and then we have this rather complex polypoid structure here, and it looks like we're in the small bowel. And based on the other structures that we see here, we might think we were perhaps in the duodenum. We've got some Brunner's type glands here with a little dilatation going on. So assuming that we're in the duodenum would be a good cause. So what does this polyp look like? Well, it's obviously got very villus type structures. Notice here it's incorporating some Brunner's type glands here. Normal type of Brunner's glands there, and then this very complex branching pattern. All through this, we see they have enterocytes, goblet cells, lymphoid stroma in some of the lamina propria. And then notice here, and this is critical, we have these strands of very eosinophilic tissue running sort of in a branching, or as some have described it, an arborizing fashion through the tumor. So we go back to low power and appreciate that structure. You see that we have streaks of smooth muscle extending up into here, around here, over in here, out into here, and everywhere seen here. Now, if we go and look at the epithelium on higher magnification, we can again appreciate that it's fairly normal appearing small bowel mucosa, normal appearing Brunner's type glands. And so rather than this being a dysplastic polyp, we would think this falls in.
Well, application in medicine is that Peutz-Jeghers syndrome is caused by changes in a gene known as STK11. Genes carry information that tells body cells how to function. The STK11 gene is necessary for the proper growth and division of cells.
Hey guys, and welcome to How to Gastro. In today's video, we will be talking about Peutz-Jeghers syndrome, which is also commonly known as PJS. So let's get started. So what is Peutz-Jeghers syndrome? Peutz-Jeghers syndrome is an autosomal dominant inherited disorder which is characterized by intestinal or stomach hamartomatous polyps together with a distinct pattern of skin and mucosal macular melanin deposition, which is usually on the lips, around the inside of the mouth, near the eyes and the nostrils, and around the anus. These spots may also occur on the hands and the feet. People who suffer from Peutz-Jeghers syndrome also have a 15-fold increased risk of developing intestinal cancer compared with the general population. So these are the macular melanin deposits that are found. They're very characteristic for Peutz-Jeghers syndrome. And they're found on the mouth, near the eyes, the nostrils, usually on the mucosal areas. And these are the polyps, the hamartomatous polyps, which are found within the intestines and the stomach of these patients. So these are two characteristic features of Peutz-Jeghers syndrome. Something to note about this disease is The risks associated with this syndrome include a strong tendency of developing cancer in a number of parts of the body. While the hematomatous polyps themselves only have a small malignant potential, less than 3% chance, patients with this syndrome have an increased risk of developing carcinomas of the pancreas, the liver, the lungs, the breasts, the ovaries, the uterus, the cervix, testicles, and other organs. So let's go back to this picture of the polyps. So these polyps themselves within the intestines, they have a 3% chance of malignancy. So these hematomatous polyps are usually benign, but they can have malignant transformation in 3% of cases. But what's very characteristic about patients who suffer from this syndrome, they have an increased risk of developing cancer in other parts of the body. And in the next slide, you'll be able to understand why, because the actual risk of them developing all these other cancers lies within the genetics of the syndrome. So let's talk about that now. The genetics. Peutz-Jeghers syndrome is an autosomal dominant inherited disorder, which means if one of your parents has the disease, you have a 50% chance of inheriting the gene and having the disease. The mutations in the STK11 gene, also known as LKB1, cause most cases of Peutz-Jeghers syndrome. The STK11 gene is a tumor suppressor gene, which means that it normally prevents cancer cells from growing and dividing too rapidly or in an uncontrolled way. A mutation in this gene alters the structure or function of the STK11 protein, disrupting its ability to restrain cell division. The resulting uncontrolled cell growth leads to the formation of non-cancerous polyps and cancerous tumors in many parts of the body in Peutz-Jeghers syndrome. So if you look at my picture on the left, you will see I put in a set of chromosomes here, and this is chromosome 19, and we're looking at the short arm or the P arm. And here is where we have the STK11 gene. And here is where people who suffer from Peutz-Jeghers syndrome have a mutation, a gene mutation, which means there's some.
In pros and cons, having Peutz-Jeghers syndrome increases the risk that the person will develop the following type of cancers: cancer in the digestive system, breast cancer, uterine cancer, a rare type of cervical cancer, lung cancer, and tumors in the ovaries and testicles.
Hi everyone. Today we are going to discuss a very important topic, that is Peutz-Jeghers syndrome. We are going to discuss the etiopathogenesis, the clinical features, the morphology, the complications, and the treatment outview of Peutz-Jeghers syndrome. So please stick to the video till the end, and we'll be capturing all the important points. So Peutz-Jeghers syndrome is a hematomatous polyp that occurs throughout the intestine and also can occur in the stomach as well, though it is more commoner in small intestine and can also occur in colon and stomach as well. Polyps have also been found in gallbladder, urinary bladder, and even nasopharynx. So here most of the cases are autosomal dominant in nature, or AD inheritance is being followed, and most of the cases are familial. Sporadic cases can also occur, but they are much rarer. And here we get classically the LKB1 or ST.
And the issue apply in Ecuador, since Peutz-Jeghers syndrome is hereditary, the condition can be passed from parents to children in a family. Peutz-Jeghers syndrome often differs in severity even among people in the same family. Some people may have many polyps and many develop cancer at a young age, while others only develop few polyps and may not develop cancer. Well, in conclusion, we have that people with Peutz-Jeghers syndrome may have other medical problems, and not all people with Peutz-Jeghers syndrome will have all the symptoms and psychical characteristics. Thank you.